Welcome to The Parent Thing. Hi, I'm Taryn, your host, and I'm so excited you're here. This is the space where we uncover the incredible potential of childhood, parenting, and the power of neurosomatic intelligence. Whether you're a parent, teacher, caregiver, or someone who deeply impacts a child's life, this podcast is your guide to nurturing emotional resilience, fostering growth, and building meaningful connections. Together, we'll explore cutting edge insights, practical tools, and heartfelt stories to empower you in shaping the next generation. Join me each week as we dive into strategies, science, and stories that inspire and transform. Let's reimagine what's possible for the children we care about and for ourselves. Now, let's begin this inspiring journey together. Welcome back to The Parent Thing, the podcast where we dive deep into the world of parenting, childhood development, and everything in between. I'm Taryn, and today we're tackling a topic that doesn't get nearly enough attention: postpartum rehabilitation. Bringing a new life into the world is incredible, but let's be real. The postpartum journey can be challenging, both physically and emotionally, from core and pelvic floor recovery to managing pain and rebuilding strength. New moms often find themselves wondering, will my body ever feel the same again? That's why I'm so excited to have Phoebe Ajayi with us today. She is a postpartum rehabilitation specialist. Today, she is going to break down what's really happening in a woman's body after birth and share advice on how to heal, rebuild strength, and feel your best postpartum. Whether you're a new mom, expecting mom, or supporting someone in their postpartum journey, this episode is packed with practical tips, expert insights, and empowering advice to help you navigate recovery with confidence. So let's get into it. Welcome, Phoebe.
Hi, Taryn. Thank you so much for having me on your show. I'm so excited to be here.
I'm excited to have you here. A friend of mine in Abu Dhabi, so she had a kiddo. He's actually 3 now. It's crazy. But she had pelvic floor issues when he was born and she went for therapy and stuff like that. And that was the first time I was actually like cognizant and aware of the fact that women postpartum have so much to deal with aside from having to keep this little person alive. And she was just the other day we were talking about pelvic floor and core and all of that. And so when I came across your profile, I was just like, yay, a conversation that so badly needs to be had because it really is something that's not spoken about. Before we get into it, though, do you want to tell our listeners who you are? What you
Yeah,
do?
so I'm Dr. Phoebe Ajayi. I am a medical doctor. I'm a postpartum rehabilitation consultant, like you said. I'm a GP in the United Kingdom. I am also a wife and a mom. I have 2 children, a nearly 7-year-old boy and a 3-year-old girl. So I could talk postpartum rehabilitation, physiological pregnancy and delivery. Those are my favorite topics to talk about. I could talk about them all day long. I also have published a book on this topic. It's called After Birth, Postpartum Recovery of the Body and Mind, and it's available on Amazon and, any major bookstore worldwide.
Amazing.
Yeah, so for my work in postpartum rehabilitation, and I also received an award from the Royal College of General Practitioners here in the UK. So yeah, I could talk about this topic all day, all night, and never get tired of it.
Let's do it. So, saying that you'll speak about it all day and all night, let's start with the basics. Can you explain what postpartum rehabilitation is and why it's important?
Yeah. So I like to define postpartum rehabilitation as the series of steps that a woman should take to ensure her optimal recovery after the physiological stress of pregnancy and delivery. I think of it this way. If someone goes into, an intense physical exercise, let's say a marathon, for instance, you have to prepare for it both mentally and physically. You have to train for it. And then when the time comes, you do the race. And then after the race, you don't just say, oh, I'm done now. Let me go back to work. There are some steps, you need to take to cool down, to replenish your electrolytes, to bring yourself back down, to ensure that you don't suffer from any injuries. So I think pregnancy and delivery are sort of like a marathon in that there is a long preparation, there's a several months leading up to one of the main events. But I find
Yeah.
that aftercare is heavily focused on the infant, and rightly so. But we shouldn't forget that mom has just been through a whole physiological ordeal for the past several months. In most cultures, there's this attitude of, oh, you've had the baby, now crack on with it. And it shouldn't be that way. I don't think it should be that way. I came across a video on social media a little while ago, and it was talking about, so basically this woman had just had a baby and she had been in the labor room for however long. And apparently her family were waiting outside. I don't know why. Not my style, but she obviously really close to her family, and they were waiting outside and they rushed in, shortly after the baby was born. And everybody kind of rushed to see the baby. I mean, because the baby is new and the baby is cute, and babies are
Absolutely.
gorgeous.
Yeah.
But I think it was only her dad who went over to check on her to make sure that
Oh,
she was
wow.
okay. And I just thought that that was just a graphical representation of what I keep harping on about. There's a lot of focus on the baby because they're new and they're cute and they're cuddly. But what about mom? She needs some
That's
support.
just been through an actual trauma. It is a
Yeah,
trauma birthing a
yeah,
baby, right?
exactly. So that's why I
Yeah.
think the conversation is very important.
Can you, from your experience, share what are the most common physical challenges new moms face after birth? Because you said it so beautifully now that women will go and have a baby, like whether it's a C-section or a natural birth, and they are expected to just crack on and just keep this kid alive and keep going as if their body doesn't have a recovery from what just happened.
So there are so many things that could go wrong, and there are so many things that people need to be aware of. But I'm always a bit cautious talking about this topic because I don't want people to live in fear as well. It's just healthy knowledge is good for you, but don't let it tilt you over into anxiety. So if I go from top to toe, picking on the most common things, I mean, and again, there is a timeline as well because some of the things can occur in the immediate postpartum period, and some of them can occur some months after. So if I think about it from head to toe, if I think of things like hair loss, for instance, a lot of women
Hmm.
experience hair loss. A lot of women experience hormonal issues, mostly thyroid related. If we're looking at the breast, a lot of women will suffer either when they're breastfeeding, they might have problems with painful breastfeeding, cracked nipples, breast engorgement, breast inflammation called mastitis, things like that. Some women, unfortunately, have heart issues in the postpartum period. So some women are prone to a disease of the heart muscle called cardiomyopathy. And also, let's not forget that things like preeclampsia and eclampsia can occur in the postpartum period as well. So that's something to be mindful of. There's a lot of gut issues for a lot of women. A lot of women might notice that they have new food intolerances. They might have problems with bloating. They might have problems with constipation, etc. So there's a lot of bowel issues going on in the pelvic floor area. So that's the area between, the area in your vaginal area, the area between the legs. So that's the perineal area. And there are some problems that can occur there as well, most notably pelvic floor dysfunction. Some women might have had a tear or a cut, and that could get infected. That could cause some scar tissue. That could lead to painful sex. Some people have problems with prolapse. Some people might have problems with, back pain, waist pain. All of these things are complications that can occur due to the pregnancy and the delivery itself. And of course, there are also nutritional deficiencies as well. I like to say jokingly that a baby is like a parasite. They will take whatever they need from you, both whilst they're in
Mm.
and after they've come out if you're breastfeeding. So a lot of women are prone to nutritional deficiencies, and more so because if your baby is not sleeping very well, like most babies will not, for the first few months, you might be sleep deprived, you might be paying less attention to your dietary intake because a lot of people are in survival mode in the first few weeks to first few months. So there's a lot of nutritional deficiencies that can go on there as well. So there are so many things that can go wrong. I mean, a lot of women will recover uneventfully, but it's just good to be mindful of some of these things, especially if you are the partner or your family member, so that you can keep an eye on these things while the new mom is focusing on caring for herself and for her baby.
That is a long list of things. And again, that's why it's such an important conversation to have because people just see the baby and mom's dealing with a whole host of things. And I mean, one of the first things you said is hair loss, and that could affect them emotionally and mentally as well. So that's just the physical stuff that you got
Yep.
into. But we'll get into all of that in a little bit. Generally, how long does it take a woman's body to recover postpartum?
How long is a piece of string? It varies, is my cop-out way of answering that. I think that it takes about 18 to 24 months to fully recover from the physical effects of pregnancy. I think that after a couple of months, most women will be back to some semblance of normal. The reason why I say 18 to 24 months is because there are molecular changes going on. There are changes still going on in the musculoskeletal system that are not readily visible to the eye. So things like fascia that have been stretched, this is the period where they start to
Hmm.
recover and regain their original strength. Also, in those months, so when a woman is pregnant, she will have a hormone called relaxin, and we can talk about the effects of relaxin later. But basically, it relaxes the soft tissue, the ligaments, and the tendons, and is one of the hormones that is responsible for the pelvis being able to open up to allow the baby to come out. Now, it takes several months for that hormone to return to baseline, and it will take even longer if the woman is breastfeeding. So, if the woman is breastfeeding, I'll say maybe add on another 9 months after you stop breastfeeding because
Wow.
there's a lot of changes going on constantly. So, again, I say about 18 to 24 months because most women are not just recovering from the pregnancy itself. Some women might have had a traumatic labor, like you said earlier, a traumatic cesarean section. They're recovering from that. And that's a major abdominal surgery if you've had a cesarean section. So they're recovering from that. Many women will breastfeed. There needs to be recovery from that. Many women will be suffering with, sleepless nights, the nutritional deficiencies that we talked about. There needs to be recovery from that. Studies have shown that there are physiological changes to the brain. There needs to be recovery from that. So yeah, I think 24
Wow.
months sounds about right.
That is amazing. And you're saying that. I saw a video on social media the other day, this woman holding her 4-week-old baby and telling us that she's pregnant again.
Ooh.
And I was just like, is that good for her body? And from what you're saying, probably not.
Yeah, probably not.
Yeah, baby was only 4 weeks old.
Yeah, because I mean, if you think about it, after the baby is born, the placenta detaches from the uterine wall. So the placenta detaches from the wall of the womb, and it's kind of like there's a wound there that needs to heal. That's one of the reasons why women are told not to have sex so soon after pregnancy, because you don't want any infections or anything going on there.
Oh,
You
yeah,
it's like trying to keep a wound site clean. So that's one of the reasons why. So for her to be pregnant when her baby was 4 weeks old,
4 weeks.
she must have had sex at least 2 weeks prior or very quickly after. And I'm gonna digress a bit because I have encountered that sometimes these women are, there's no nice way to say this, but they were being made to have sex against their will. So they have partners who just can't give them respite for a few weeks to, recover well. So it's a form of domestic abuse. So some women, it's not really by choice, it's just because of
Mm,
domestic abuse that they find themselves in that situation.
that's really sad. And
Yeah.
I guess that opens up a whole different can of worms, right?
Hmm.
Yeah, so you spoke about the pelvic floor earlier. How does pregnancy and childbirth impact the pelvic floor and core muscles?
Right. So here we go. The pelvic floor is a group of muscles that supports the pelvic organs, and I'll go into that in a bit more detail. So, if you think of it like a trampoline, for instance, the pelvic floor is a trampoline, and then on top of that sits the pelvic organs, which would be the urinary bladder, where your urine is stored, the uterus, where the baby grows, the bowels also sit on that muscle, and each of these organs has an opening through that muscle. So the pelvic floor surrounds your urethral opening, which is where the wee comes out, the vaginal opening and the anal opening. They're all surrounded by the pelvic muscle. So it's a group of muscles. The pelvic floor can undergo a lot of strain in pregnancy and delivery. Because like I mentioned, if you think about it, all these organs are sitting on the pelvic floor. And yes, they are supported by ligaments, but the sheer weight of the baby, the uterus, the amniotic fluids, and all of that put together could be about some 7 kg and is all sitting on the pelvic floor. So that can cause some strain on the pelvic floor muscles.
Hmm.
During crowning of the baby, there is an opening, right, for the baby to come out. So that stretches the muscles, it stretches the fascia around those muscles. The fascia is like the envelope that surrounds the muscles. It stretches those fascia, and that could put some strain on it. Now, if a woman has an instrumental delivery, so I'm talking about forceps, vacuum, things like that, can put added stress on the pelvic floor. Some women will have perineal injuries, so birth injuries, maybe a tear during the process of delivering the baby, or they might have to have an episiotomy. All of those things put strain on the pelvic floor.
That is a lot. I always say moms are superheroes, but you just giving me like a whole nother respect for what a woman actually goes through. So when you say like all these things will put pressure on this group of muscles of the pelvic floor, how will a woman know that they've got some pelvic floor dysfunction? What are some of the signs that a woman may have that tells them they've got some pelvic floor dysfunction and it needs some rehab?
Most common symptom is usually incontinence, mostly urinary incontinence. So urinary incontinence is the involuntary, sorry, escape of urine. That's the woman is leaking out urine without control. So sometimes it might be total, meaning that the incontinence is there randomly and persistently. Sometimes it might be stress incontinence, which is when there is an escape of urine during times of increase in the intra-abdominal pressure. So think when coughing, when laughing, sneezing, jumping. If you do those things and some wee comes out, that's a form of stress incontinence. And there's urge incontinence, which is when you need to have a way you really need to go now. Like some women will start to wet themselves on the way to the toilet. Some women have a combined form of incontinence, but yeah, urinary incontinence is one of the most common symptoms of pelvic floor dysfunction. There are others. There can be fecal incontinence, that's involuntary escape of feces. There can be constipation, there can be pelvic pain, hip pain, back pain, painful sex. Diastasis recti is also linked to pelvic floor dysfunction because the deep core muscles work in tandem with the pelvic floor muscles. Just trying to think, have I forgotten anything? I think I've mentioned all of them.
That's really good to know. So, if a woman finds that she may be having some pelvic floor dysfunction, can you share a few beginner-friendly exercise to strengthen the core and pelvic floor?
Yeah, of course. I recommend these exercises to all women. I think it's great to have the knowledge even before your child rearing days and for you to continue to practice during pregnancy, after pregnancy, and really for life. I would recommend these exercises to all women and men too. They have some beneficial effects in men as well. So I've described already where the pelvic floor muscles are located. So if you're thinking of contracting your pelvic floor muscles, you're thinking of drawing your vagina upwards and inwards. That's the easiest way to describe it. So you should feel the contraction in your vaginal area and you should also feel it in your anal area because remember I said the pelvic floor surrounds these organs. Easy way to do it is to insert a finger into your vagina and try to squeeze that finger. And it's a very subtle movement because those muscles, they're highly specialized and they're just located in that small area. So it's a very subtle movement. It's not strenuous at all. So avoid the temptation to bear down, which is like pushing downwards. You shouldn't be pushing downwards. Your perineal area should lift inwards and upwards. One visualization that I've seen that I think is actually good is that imagine you're trying to suck up some juice and your vagina is the straw. So you're drawing it upwards and inwards. Yeah. Another visualization that I saw is like trying to imagine picking up a grape with the vaginal muscles. So you're drawing it upwards and inwards. Now, this is something that I personally recommend everyone to use their finger because when you use your finger, you can feel the different zones of the pelvic muscles in the vagina. You'll be able to feel the different zones, and it just gives you instant tactile feedback. Do you understand? There is another way which is recommended just for you to be able to isolate those muscles because a lot of women have never tried to contract their pelvic floor muscles before, so they don't even know, am I doing
Mhm.
it? One way of doing that is to try to interrupt your stream of urine. So if you're sitting on the toilet having a wee, try to interrupt the stream of urine using your vaginal muscles only. So you should be able to feel the contraction in the vaginal area and in your anal area. But this is not something that you should be doing frequently. It's just for you to be able to isolate those muscles because you don't want to be interrupting your urine stream. You don't want to irritate your bladder and all of that. So it's just for you to be able to isolate those muscles so that you know when you're contracting them. So again, I would recommend few, it's a simple exercise. You can do like 20 contractions 3 times a day. One key moment that I read about is you can tie it to something that happens every day in your day. Say, for instance, you might say, I'm going to do my pelvic floor contractions every time as I'm brushing my teeth. That's the beauty about it. You can do it anywhere, anytime, because it's such a subtle
Mm-hmm.
movement and there's no outside, nobody can say, oh, look at her. She's doing her pelvic floor contractions now. It's a very subtle movement, very private movement. So you can tie it to that. Maybe, oh, I'll do my pelvic floor muscles every time I'm brushing my teeth or right before my meal or, because yeah, maybe brushing your teeth, you only do that twice a day is good enough, is a good start. But I would say we recommend about 20 to 40 contractions 3 times a day. So one other one that I saw is somebody said, I'll do my pelvic floor contractions every time I see a red light, when I'm driving.
Oh,
So
okay.
yeah, it's just tied to a cue that you know is going to happen every day. And you just do your pelvic floor contractions every day. And then one other crucial thing I would say is the relaxation is as important as the contraction because as bad as a too lax pelvic floor is a pelvic floor that it's too tight. A strong
Ah,
pelvic floor, yeah, a strong pelvic floor should be able to go through the full range of motion. And the way that I try to describe it is this. If you're trying to, let's say you want to build up your biceps, for instance, you do some biceps curls, you're not going to keep your biceps, permanently flexed. You're going to do the full range of motion to strengthen it. So similarly with the pelvic floor muscles, it's best to go through the full range of motion. So contract and relax. Contract, hold it for a few seconds and relax. And also, you want to be doing the two types of exercises. So you want to do the fast twitch exercises, which is basically contract, relax, contract, relax, contract, relax. And then you want to switch on the slow twitch fibers as well, which is contract and hold for a few seconds and then relax for an equal duration of time.
very interesting. This is so fascinating. Earlier, you mentioned that many women experience like back pain, hip pain, joint discomfort, and other painful experiences after birth. What causes it? And then how can they find relief?
Yeah, what causes it? That's a very good question. The cause is multifactorial. Relaxing that we talked about, the hormone that we talked about earlier, is definitely one of the factors. Pelvic floor dysfunction is one of the factors. Another one of the factors is posture. Because if you think about it, when you're pregnant, your tummy is so big, it's pushing on your back. Some people get stuck in that position. So a lot
Mhm.
of women are left with what we call an anterior pelvic tilt after the pregnancy. Sometimes it's just because of our posture, like when you're breastfeeding. I see this a lot. A lot of women are hunched over, even if it's bottle feeding, they're hunched over the baby when they're trying to feed. So sometimes we kind of get stuck in those suboptimal postures and you need some help to be able to bring everything back in alignment. One way that I describe it is this: if you hurt your knee, or let's say you hurt your ankle, for instance, and you're kind of limping to compensate for that, as tends to happen to most people, shortly after you're going to have a pain in your hip, even if you never hurt your hip at all. So sometimes it's because of maladaptive ways of compensating to strains. That's what causes these pains to linger.
So you just spoke about posture and how women can get stuck in a certain posture. Are there any specific postural adjustments or movement patterns that can help alleviate the postpartum discomfort?
Yeah, certainly. I think the most common one that I see is shoulders hunched, probably because of
Mm-hmm.
stress, probably because you're carrying the world on your shoulders. It's very easy to get, just check in, remind yourself, bring the shoulders down. I think that's one of the most common and easily remedied maladaptive postures that I see. Another one is like, again, hunching over the baby, like I explained earlier. And it can be kind of difficult because when you get nap trapped, in that suboptimal position, if the baby's asleep, you might be frightened to move. I don't want to wake them and all of that. So I always say baby to mom, not mom to baby. Especially
Okay.
if you have a partner, a supportive partner, or you have a cot where you put your baby down. Get yourself well positioned. So not slouching, not sitting on your spine. You know what I mean? When you tuck your bum under, not that. Get yourself properly positioned, your spine in good alignment. Support yourself with pillows if need be, and then bring the baby to you, regardless of if you're breastfeeding or bottle feeding. So
Or
that way
bottle feeding.
you're already in an optimal position. So when you bring the baby to you, it's easy to make them comfortable and they're so flexible. So if the baby falls asleep and you don't want to move, you're already in an optimal position rather than being trapped in an awkward position. I remember there was a time I was trapped with my baby in a very awkward position, and she was such a bad sleeper. And I was thinking, oh, she'll soon wake up. I don't want to move. I don't. She'll soon wake up. And she slept like that for over an hour. And by the time she woke up, I had cricks in my neck. So you can prevent that from happening by thinking of baby to mom, not mom to baby.
What role does C-section recovery play in postpartum rehabilitation, and then how does it differ from vaginal birth recovery?
I feel like we don't give C-section moms enough credit, because it's a big physiological stress. It's major abdominal surgery. It's the only surgery where somebody goes through all these layers and does an open abdominal surgery and stitches you up and say, okay, here you go. And also look after this baby.
Right, it's like 7 layers that's cut through, if I'm
Yeah,
not
yeah,
mistaken.
yeah, and also look after this baby. So it can be challenging, especially if it was an unplanned cesarean section. So if it's an unplanned cesarean section, the odds are that the mom might have been laboring for some time. She's also gone through some of the physiological stress of the labor itself, and now she has to have a C-section on top of that. And oftentimes she might be sleep deprived. Maybe there was a complication already, and that's why she's had to have an emergency cesarean section. So all of these things affect the recovery. Planned cesarean sections, they usually tend to go more smoothly in terms of the recovery, but it's still a big physiological stress. I will say that having a cesarean section doesn't necessarily ease the strain on the pelvic floor, because most of the stress on the pelvic floor comes from carrying the pregnancy itself, not necessarily from the delivery process. So a lot of women who
Ah,
have had, yeah, cesarean section, they might still have some issues with pelvic floor dysfunction, like incontinence and the rest of it that we talked about earlier. But yeah, so it's just recovering from the surgery. Sometimes they might not be able to stand up straight because of the suture lines, and they also having to look after a baby. It can be very difficult. And long term, a lot of C-section moms can have like a lot of scar tissue forming around the C-section scar, and sometimes it kind of makes that area stuck. It's called tethered. So they might have a tethered scar and it might be stuck, and some might have like a shelf, a C-section shelf. You might have heard of it, a C-section shelf, and some of them might have aches and pains relating to that tethering. Because if you remember, when we're talking about the fascia, I mentioned that the fascia is like an envelope that surrounds the muscles. So if the fascia is stuck, if it's tethered, it can affect the movement of the muscles as well. So sometimes the aches and pains comes from scar tissue.
that's a lot. It's a lot that a woman goes through.
Yeah.
And as you said, now you got to keep this baby alive. Like you've got all these scars, you've just had this major surgery. Here's your little stitches and go keep a human alive while healing yourself. That's a
Yeah.
lot. It kind of also explains why women have like mental and emotional issues aside from the physical with everything that they go through. So when we look at physical recovery, how does it influence emotional and mental well-being?
It's all closely intertwined, isn't it? Because I think that the being pregnant itself and, having to go through delivery puts a psychological strain already, because the hormones, they fluctuate. Sometimes they affect your mood, sometimes, and then after the delivery, there's a sudden withdrawal of these pregnancy hormones. And then there's all these changes again. So a lot of women will have postpartum blues, but some women will also have postpartum depression, in more rare instances, postpartum psychosis. So they are closely intertwined. It's been observed that when a woman is less than pleased about how her labor and delivery have gone on, because sometimes you have a plan, right? You think your labor is going to go like this, but then it goes the other.
Mm.
Some women grieve the loss of the birthing experience they thought they would have. So that can be a big, emotional stress as well, on top of everything else. Some women are disappointed by certain aspects of the labor and delivery process, or maybe they had to have an unplanned cesarean section, or maybe their partners were not as supportive as they thought they would be. That's a big emotional toll as well that needs to be unpacked after the labor process. There is, I don't know how it is in other countries, but many hospitals in the UK, they offer a birth debrief service, which is basically You go in, you talk to one of the midwives or one of the healthcare professionals. They go through your notes with you and tell you this was what happened, this was exactly what happened. It just helps you to put together a timeline, if you will, of
Mm-hmm.
the events. So with my first, for instance, with my first, I was in labor for almost 4 days and everything was just a blur. By the time I couldn't sleep at all during this period. I nearly ended up in an emergency cesarean section. I had some painkillers. I had the oxytocin drip. It was all a blur. I really struggled with it. So I went back for a debrief service. I said, just walk me through it. And it just being able to say, okay, this happened at this time, and then this happened, and then
Yeah.
this happened. It was just like, okay, filling in the blocks in my brain. And it
Mm-hmm.
just helped me to process that and move on, from grappling with those thoughts. So I highly recommend it if it's a service that is available to you locally.
Yeah. I know that there's also, I last week spoke to a postpartum doula, and I'm sure that they can help with that kind of thing as well. Like kind of putting the
Yeah,
puzzle pieces in place that parents may be struggling with or unsure of. What role, if any, does movement play in preventing or managing postpartum depression and anxiety?
absolutely. Movement, 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 movement all day. I love to exercise. I exercise every day. I love movement. Let's look at it from two aspects. First of all, it's widely documented already that exercise is great for your mood because when you exercise, your body releases your natural feel-good hormones called endorphins. So, I mean, what's the reason not to exercise? Especially if you're exercising outdoors in nature, double benefit. In fact, some studies have shown that exercise is as good as antidepressants in mild to moderate depression.
Wow.
Yeah, so exercise is that powerful. And some people say, I don't like to exercise. There's so many kinds of exercise that you can do these days. I think that sometimes we get stuck thinking that unless I'm sweating in a gym somewhere, it's not exercise. But no, do you like to walk? That's exercise. Do you like to swim? That's exercise. Do you like to dance? That's exercise. You like to skip? That's exercise. So the crucial thing is finding something that you enjoy so that you can stick to it. If you enjoy it, it's not like a chore. It's not like, oh, one more thing. If you enjoy it, then you enjoy it and you're having fun. I like to dance sometimes. I like to do resistance training and weightlifting because I know the physiological benefits. But some days I don't feel like doing that and I just go for a walk or I just dance. If you ride a
Hmm.
bike to work, that's exercise. So that's great. And also, physical exercise will help prepare one for labor and delivery. And also, if you're already the exercising type, it might make your pregnancy easier on you. It might make your labor easier, and it will definitely, definitely help your postpartum recovery as well. What's not to like?
Absolutely. So let's talk about the exercise. When is it safe for a new mom to return to exercise, and how should she ease back into movement?
I guess it depends. If she was really into fitness before having the baby, then she'll be ready to go back to exercising earlier than somebody who hasn't been exercising at all and is just trying to start. I never stopped exercising, basically. So it's difficult. Like, it depends on everyone's fitness level and
Hmm.
everyone's your birth. Experience. Because if you've had a traumatic birth, if you've had an unplanned cesarean section, or if you had a cesarean section, it might take you a little bit longer before you can go back to exercise. I would say definitely check in with your midwife, your doctor, your healthcare provider. But generally, most people, I would recommend you to start with some deep core breathing and some pelvic floor exercises as soon as you can postpartum. There might be some soreness, in your pelvic area, especially if you've had a vaginal delivery. So just be guided by your comfort levels. Sometimes, because of all the stretching that has gone on there, you might feel a bit of a disconnect between your mind telling your pelvic floor to do the contractions and your pelvic floor actually doing it. So I'll say in those first few days to couple of weeks, start building that mind body connection again. Start getting your pelvic floor to respond and start working on some deep core breathing, some 360 breathing. That will be the basis and that will be the foundation of subsequent exercises. And as soon as you feel able to, you can go on a walk. If you've had an uneventful delivery, nothing stops you from going on a walk the next day, 2 days later. I think it's just good to get out of the house. It might be for 5 minutes, it might be for 10 minutes, but
Hmm.
just slowly build it up to your comfort level.
What would you say are some of the biggest mistakes new moms make when they're trying to bounce back or snap back after birth?
Bounce back. I don't like that
Yeah. Bounce back.
I think the major mistake is trying to bounce back in the first place. I don't think I've met anyone who was unchanged by labor, by pregnancy and delivery in some way. You might
Hmm.
still, I mean, a lot of women might go back into their pre-pregnant weight, but they'll tell you that, my hips are wider now, or my ribs are wider now, my bra size has gone up, or my bra size has gone down. Most people, I have not met anyone who wasn't left with some physiological change of the pregnancy
Hmm.
and delivery process. So I personally, I don't believe in bouncing back. I believe in springing forward.
Oh, I love that.
I literally just came up with it.
I love it.
So this is my take on it. Focus on being the strongest, healthiest version of yourself. So I think that having this idea of I want to bounce back, I want to fit into certain clothes, it puts a lot of pressure on a new mom. And also, I feel it detracts from the magic of the postpartum period because especially if you're in a place where you're lucky to have a decent amount of maternity leave, it's like you're in this love bubble with you and your baby, and
Yeah.
just try to cherish all those moments. Try to cherish all those moments. You will bounce back, at some point. But if you're putting too much pressure on yourself, then you're not living in the magic of that moment. Most common mistake people make is putting pressure on themselves to bounce back, rushing into exercises that are too intense too quickly, and in this process, causing more injury to the pelvic floor. Some people want to get the flat abs back and they head off into crunches and exercises like that.
Mm.
But those tend to worsen things, especially if you have diastasis recti. So I would say give yourself time. Don't be in a haste to bounce back. Avoid exercises that are too intense too quickly and avoid crunching type exercises because they can put a lot of pressure on the abdominal musculature.
That's very interesting. How can moms safely integrate strength training, especially like using dumbbells into their postpartum fitness routine? Because you said you're a big advocate for that, right?
Yeah, I am. Start small, start slowly, build it up gradually. As with every exercise, it's best if you have guidance. So if you can afford it, if you go to a postpartum, there are a lot of postpartum fitness classes around now, and that's great. You might want to ease into it with something like resistance bands. You might want to ease into it with that. But yeah, if you're starting up with dumbbells and weights for the first time, start with lighter weights, start with fewer reps, and build it up gradually.
Okay, that's pretty practical, I'd say. What would you say are some practical ways that moms can find time to focus on rehabilitation with a newborn at home?
With a newborn is very difficult. I'm not gonna lie. It's very
Hmm.
difficult. I think that especially if you have your newborn and you have other children, so you have so much on your plate. And that's why I say be kind to yourself. Don't put yourself under undue pressure. If you can go out for a walk, do it. If you can't go out for a walk, if you can do your pelvic floor exercises, that's something. If you're interested
Yeah.
in building physical fitness, I think doing something every day towards that. It can be something little. It might be 2 minutes, it might be 5 minutes. Sometimes when I'm like, if I have a busy clinic day, when I'm in between patients, I run on the spot just for 30 seconds and doing that multiple times through the day. So if I might do it like 5 times through the day, maybe for a minute, 30 seconds. And if you put it all together, I would have spent maybe 5 minutes or less doing that. But those little bursts of activity increase my heart rate and they have overall
Hmm.
health benefits as well. So it's as good, as a workout session. So if you don't have the time to get a 45-minute workout session and all of that, then just do the little you can when you can. When I had my babies, when they were tiny, I used to exercise with them in the room. Even now, sometimes they'll join me when I'm exercising. And, it's good fun. It might not be as intense as I
Yeah,
would have liked, but it's fun and it's good for me to model that exercise is a healthy way of life to them as well. So
right.
yeah, it's just do what you can with what you have. I'm very keen on not putting pressure on moms, especially if you have little babies. This time will pass, I promise you, and you'll be able to focus on your goal. So I have a 3-year-old now. Now she sleeps through the night. and she goes to bed at about 7 p.m. And I have that time till I go to bed quite early, about 9, 10 p.m. I'm in bed. So I have that time to
Mm-hmm.
do one or two things to myself. But I also wake early. I'm an early riser. So I'm up by like 5 a.m., half five. I know some people cannot do that. But when I wake up at that time, I can get in my exercise. I can get in my prayers and devotion. I can meditate and set my intention for the day. So, whereas
Mm-hmm.
I couldn't do this a year ago because of her sleeping pattern, so that time will come. They will sleep through eventually. You will get some of yourself.
Are there any specific nutrition tips that support postpartum recovery and muscle repair?
Yeah. Your protein. Make sure you're getting in your daily requirement for protein. There is a energy expenditure calculator. If you Google it online, you find out what it is, and it will recommend how much protein you need. I'm very particular about this, especially if you're a breastfeeding mom, because you're still burning a lot of calories, you're still giving a lot of nutrients in your breast milk. So protein, very important. Get your veggies in as well. I actually recommend women to continue to take pre or postnatal vitamins. If they're breastfeeding, continue to take it. If you're not breastfeeding, I'll say continue to take it for at least 3 months postpartum, just so that you can replenish any depleted stores. But yeah, that'd be my advice.
Mm-hmm.
Get your protein in, get your veggies in, and take a supplement.
What advice do you have for moms who feel discouraged about their postpartum recovery?
Why? I would ask why. Why do you feel discouraged in the first place? Sometimes it's because of unmet expectations. I was discouraged after my first. I told you how traumatic it was, and I had to come to terms with it after some time. So I guess the important thing is, what am I feeling? And then why am I feeling those things? And then when you know why you're feeling those things, is it true? So for instance, it might go something like this. What am I feeling? I'm feeling sad.
Mm-hmm.
I'm feeling disappointed. Why am I feeling that way? Because my labor didn't go as planned. But why? I feel like my body failed me in that moment. Is it true? Did your body actually fail you? So challenge those thoughts objectively. And let's say you might say, oh, yeah, it's not true. There were things outside of my control. Or you might think,
Mm-hmm.
oh, something is true. Okay, then what do I do with this information? I'm very keen on that question. Is it true? Because sometimes your mind will play games on you. So bring it out into the light and ask that question. Is it true? And answer honestly and objectively. Bring it out in the light. And then what do you do with that information? Okay, so I might say, okay, I know it's not true that my body disappointed me, but I'm still really struggling with that. Or, oh yeah, hey, my body didn't disappoint me. I did the best I could. Let's move on. Now, some people might still be stuck here. And what I would advise is, I can't remember the exact phrase, but your listeners will know what I'm talking about when you say there are things that you can control and there are things you cannot change. And this is a prayer, is a popular prayer that says, God give me.
It's the serenity prayer, yeah.
Yeah, exactly. And so to know the difference between the two. So if you can control it, what are you going to do about it? If you can't control it, give it to God or your higher power, or you might want to go into therapy to just, learn how to come to grips with it all. But if it's something that you
Mm-hmm.
can control, say for instance, some women struggle because they gained a lot of weight when they were pregnant, and now you're here and you're feeling a bit sad about it and you want to do something about it. That's great. What am I feeling? I'm feeling sad. Why? Because I gained so much weight in my pregnancy. Is it true? Yes, objectively, it's true. I'm now maybe 20 kg heavier than I would like. So now I can do something about it. So you can work with a dietitian, or you can watch your portions. You can keep a food diary. You'll be surprised. I was surprised how much chocolate I eat when I kept a food diary. So it's just things like that. Yeah, that's the way to work it out. And just try as much as possible not to let it linger for too long, because it can affect your postpartum experience and it can have long-term
Mm-hmm.
health sequelae as well.
When you were talking, the problem that I thought of that I've seen a lot of moms deal with is wanting to breastfeed and then not producing milk
Mm.
that's sufficient for their baby. How can we encourage moms who are struggling with that?
It's very difficult, and my heart goes out to such women.
Mm-hmm.
I breastfed. Sorry, I'm no longer breastfeeding them. Breastfed both of mine. With the first one, it was very difficult. I struggled a lot. In fact, I couldn't breastfeed him directly for a few weeks, so I had to pump. and, give to him. And then one day, by divine inspiration, he suddenly was able to breastfeed. I would say if breastfeeding is really important to you, get in touch with a lactation consultant. There's so many of these
Mhm.
nowadays. So here in the UK, we have some of them on the NHS. We have some charities that provide these. We have independent lactation consultants. A lot of women don't know about this. So try that. Make sure your diet is optimized. Make sure you're drinking enough water because if you're not consuming enough calories, breastfeeding takes on extra calories. I think I read somewhere about 500 extra calories in a day, something like that, especially in the
Wow.
first couple of months. So if you're not getting enough calories in, your body might struggle to make the milk that you need. Try different positions, breastfeeding positions, try them. So what I said by divine inspiration, my son would, I tried so many positions, he wouldn't. And then by divine inspiration, I tried this really awkward looking position. And that was the only position he fed in for about 6 months until he was a little bit bigger.
Wow.
Yeah. So it was so try different positions. And if you're the partner or family trying to support someone who is trying to breastfeed, don't fill her ear with negative talk, like, why are you stressing yourself so much, stop doing this, you're being selfish because you want to breastfeed. All of those negative talks can actually affect a woman's ability to produce milk and affect her breastfeeding journey. And as a woman, if you've tried all these things, you're drinking enough water, your diet is on point, you've tried the lactation consultant, you've tried the different positions and all of that, and you've tried all the online lactation recipes and the lactation cookies, then it's out of your control. And you just have to
And
learn.
so then it just comes to that
Yeah,
acceptance,
yeah,
learning to accept in as much as that is a difficult thing.
yeah.
Are there any resources that you can recommend for postpartum rehabilitation? So books, programs, people to follow on social media, just any resources.
Yeah, read my book.
Yes, let's plug that first.
It's called After Birth, Postpartum Recovery of the Body and Mind by Dr. Phoebe Ajayi. It's available on Amazon, Barnes and Noble, any major book distributor. I would recommend following. Oof, I'm trying to remember her name now. She's a postpartum pelvic floor. She's a post pelvic floor physiotherapist. I want to say her name is Ashley Keller and Sarah Duval Ellis. I hope I'm remembering their names quite right. Ashley No as well is a postpartum fitness instructor. I recommend all these women. There is the pelvic floor charity. I can't remember the exact name it's called now. So I actually recommend following pelvic floor therapists, especially if you someone that spends time on TikTok or social media, because they will come up on your feed. You will see them reminding you to do your pelvic floor exercises. They put out loads of good content, and I mentioned these ones because I can vouch for their content. Put out loads of good content on exercise, on movement, on
Mhm.
breath work. So yeah, I would recommend them. And of course, there's the Lalesh League, is a charity in the UK that supports breastfeeding, and National Child Trust, NCT. And of course, there's Good Old Baby Center. They have a lot of articles there as well. So there's so much information out there. But definitely start with my book.
Absolutely. So I'll put that in the show notes as well. Phoebe, if listeners take away just one key lesson from today's conversation, what should it be?
You're doing a good job.
Hmm.
You're doing a good job. Love yourself. Pregnancy, the shift from, especially if it's your first child, the shift from not having children to having a child is a big identity shift, is a big psychological shift. A lot of people struggle with it. There's always thought of, am I doing the right thing? Am I good enough? And a lot of people lose themselves along the way. So if you're listening to this podcast, that means you're trying to get information, to support your journey, which is more than a lot of women ever do. So if you're listening to this podcast,
Very true.
you're good enough. You are the mom your baby needs. Chin up and love yourself.
That's powerful stuff. Phoebe, how can listeners reach you if they want to follow you on social media? Or I know the book will put in the show notes as well, but how else can they reach you?
You can go to my website, phoebeajayi.com. I am on Instagram, Phoebe Ajayi. LinkedIn, Dr. Phoebe Ajayi. Yeah.
Thank you so much for taking the time to chat with me. I have learned so much. This information was incredible. Thank you so much for sharing your expertise.
You're so welcome, and thank you for having me here. It's been awesome. Thank you.
Absolutely. Thank you for being our guest.
Thank you for tuning into the parenting. We hope you enjoyed today's episode. If you have any questions, feedback,